shifted their production lines to different sectors and to produce different products to cover the needs of the market, especially after the pandemic happened. Today, we have with us here today from the government sector, definitely Dr. Abdulaziz Al-Muhairi, Director of Sharjah Healthcare City. We have Mr. Ismail Ali, the CEO of Strata. We have also Mr. Ismail Tog, and he's from Sharjah Open Innovation Lab at the Sharjah Research and Technology Park. And from the private sector, we have Mr. Mohammed Javid, the Business Excellence Manager at Falcon Pack Industries. So the focus today might be on the PPE, which is the personal protective equipment, and how this industry actually boomed during the COVID, and how some companies came up with creative ideas to shift their production lines and to navigate their businesses to cover the needs of the market. To start with, I will ask my panelists just to introduce themselves more and to introduce their respective entities, and maybe later we can jump to the question. So I will ask His Excellency Dr. Abdulaziz to start by introducing himself.
Bismillah ar-Rahman ar-Rahim. It is my pleasure to be with all of the esteemed guests today to discuss these important issues, especially in the time of the coronavirus COVID-19 outbreak, which started in 2019 and is still going on. I represent Sharjah Health Authority. I work as a Sharjah Health Authority Director, as well as a Vice Chairman of the Board of Trustee of the University Hospital of Sharjah. In addition of that, as I discussed with Mr. Mohammed Al-Musharraf, I have other identity, which is a member of the Food Security Council, which has been affected also. You know, the food security is very important alongside with the health issues. We'll talk, inshallah, later about mainly the health sector, and if any other issues regarding the food security, will be my pleasure also to elaborate more in this sector. Thank you.
Thank you, Doctor. Mr. Ismail Abdullah, please.
Excellencies, distinguished guests, ladies and gentlemen, good afternoon. And my good friend and brother Mohammed, thank you very much for the invite and having me. So I represent a company called Strata Manufacturing. We are an aerostructures manufacturing company. So we manufacture parts for aircrafts. We are based in the city of Al Ain, and we were founded a decade ago. That's 10 years ago. We manufacture for the largest aircraft companies in the world, the likes of Airbus, the likes of Boeing, the likes of Leonardo, which is an Italian-based company. Whether you are flying on an Airbus A330, Airbus A350, or an Airbus A380, whether you are flying on a Boeing 777 or 787, these are some of the programs that we manufacture parts for. Also, we have started diversifying our business from dependency on wide-body aircrafts to also manufacturing for business jets. We've teamed up with a company called Pilatus, based out of Switzerland, and we have 2 production lines. We grew from 1 production line to 13 production lines. We are proud that our parts that are made here in the UAE are on 8% of the worldwide fleet of wide-body aircrafts.
Thank you, Mr. Ismail. We will move to our other Ismail, Mr. Ismail.
Hello. Thank you, Mr. Mohammed. Thank you for the invitation, and it's my pleasure to be part of this webinar to talk about our experience during the COVID-19. Basically, I represent Sharjah Research Technology and Innovation Park, and mainly SOILAB, or Sharjah Open Innovation Lab, which is an initiative by SRTIP. SRTIP aims basically to develop and manage innovation and an innovation ecosystem within a free zone that promotes research, development, and support enterprise activities and collaboration of industry, government, and academia. And part of that, or an essential part of that, is the establishment of an open innovation lab, which is basically a prototyping lab equipped with different technologies such as 3D printers, metalworking equipments, laser equipments, electronics, and robotics. And basically, the aim of that is to support the idea generation process, and basically try to support engineers, designers to basically bring ideas into basically full-scale production. And basically, we're still currently working on building the infrastructure for this lab. We've been delayed basically because of the pandemic, the full opening of the lab, but we are still operating. We are still working on several projects with different partners, and one of them is what we're going to discuss today. And I will leave it for later. So.
Thank you, Ismail. Now we will move to Mr. Mohammed Javid from Falcon Pack to introduce himself.
Thank you, Mr. Mohammed, for the opportunity today. Let me start by wishing you all well. I hope you're safe and well during this time. Alhamdulillah, we have passed through a tough situation of this COVID. Well, I'll introduce myself. I'm Manager Business Excellence in Falcon Pack Industries since a few years. Falcon Pack is mainly a food packaging manufacturer and distributor. It's one of the very well-known brands of UAE, not just in UAE, but also in GCC and some around the world, other countries. But along with the food packaging, we also have Falcon Detergents, which focuses on the business of hygiene products, detergent and hygiene products both together. Plus, we have multiple revenue streams, meaning like we are targeting multiple customer segments. So our customer segment range is very, very diverse. We are operating in multiple markets. We have UAE market. We are operating in GCC across all the GCC countries. Plus, we internationally we are present across different regions and continents through our distributors. And our products are reaching all those markets. And for us, the situation of COVID was basically an opportunity to assess like what basically our capabilities are in terms of supplying to the demand. So hopefully today, inshallah, during my discussions, I'll be able to explain like how we were able to manage during COVID situation. Thank you.
Thank you, Mr. Mohammed. So we have a diversified team, people from different backgrounds. We have people from the healthcare industry. We have people from the aerospace industry. We have people from food packaging industry. And then we have someone also from an innovation lab. And today we will talk about one topic, which will mainly be the personal protective equipment and how some of the government decisions and the government instructions changed the behavior of people, which led to an increase in the demand of certain products. If I go to His Excellency Dr. Abdulaziz Al-Mheri. Dr. Abdulaziz, you have been in the healthcare sector for more than 20 years. You are part of government entities, you are part of a hospital, you used to be also in healthcare when it comes to sports as well. I have a question for you, Doctor. Now, you know the instructions that we got by the government regarding the protection and protective measurements that we have to take. And one of it is wearing the mask is mandatory when we go out, which led to a huge demand in masks and gloves and personal protective equipments in general. Do you think that this will continue even after COVID-19? Do you think that this will be part of the culture and people's mindsets? Do you think that this demand on masks and protective equipments will continue for some time, even after COVID-19?
Well, I think the use of personal protective equipment is very important. Before COVID-19, and it will continue after COVID-19 for sure, because for COVID-19, the situation is that there is no definite treatment for COVID-19. All the kind of treatment which is available now is to enhance the immunity level of the patient and treating the symptom and easing the complications. So what you can do is to protect yourself from being affected by such virus. Today we have a COVID-19. We don't know in the future what kind of viruses or epidemics can be spread all over the world. So the demand of personal protective equipment, it will still grow. And when we are talking about the PPE, we are talking about many kind of items. What we see in the community is only the mask and the gloves. But if we go into more details in the medical field, we need more kind of protective equipment, like head cover, goggles, face shield, mask, gloves. This is, we know it for sure. Gown for protecting the body of the healthcare providers, and shoe covers also. So all of these items are disposable and it need to be used frequently and many times during the days. You don't wear it only once and you keep it until the end of the day and you throw it. No, you have to shift to change the protective equipment from patient to patient. And you can imagine how many patients that can be affected, or how many patients you see it every day. The statistic and the total number now confirmed in United Arab Emirates are 62,966 affected confirmed cases. And recovered, alhamdulillah, it is a large number has been recovered, 56,961. And the number of total death, 359 until yesterday. This is the last statistics. If we compare it to the number of all over the world, we are in a good situation in the United Arab Emirates, alhamdulillah, because of the government rules and regulation and actions which were very effective in all sectors. If we compare it to the total number, the confirmed cases now all over the world are 20,292,486 confirmed cases. And the total number of death, 741,380 confirmed death cases. So the situation is serious. We don't want to spread the fear in the community, but we have to spread the awareness and the acceptance of the situation and how to deal with the situation. And with the different sector, collaboration between all different sectors, I think it will help us all to overcome this period, especially from the industrial part, from manufacturer part, distributors, and also the research centers.
Thank you, Doctor. So I understand from what you have said that there are much more opportunities in terms of PPAs beyond masks and gloves, where we saw there were a lot of companies focusing on maybe those two items, maybe because they are the most used two items. That's why we have seen a lot of companies shifted their production lines to these kinds of products, especially here in the UAE. So we have a lot of opportunities,
Yes.
different opportunities in PPEs other than masks and gloves. I will
Yes.
move to Mr. Ismail Abdullah from Strata. We know that Strata is a well-known company in the aerospace business, a company that we as UAE nationals are proud of. I have myself visited Strata and I was amazed by what I have seen there, especially where 100% of the workers are UAE nationals, and most of them are females, as I still remember. And they produce parts of the airplanes for the Airbus and other aircraft. Aerospace is one of the most affected industries during the pandemic, and we have seen the shift that Strata have done and the tie-up with Honeywell by having a new production line for the KN95. So, Mr. Ismail, if you can tell us more about the new partnership and the tie-up with Honeywell, and what made you take this decision to shift from aerospace into manufacturing of the KN95, and the KN95 is a special mask, as we all know.
Thank you, Mohammed. Let me start by building on what His Excellency Dr. Abdulaziz said. The response to the pandemic and to COVID-19 from the leadership here in the UAE is actually an example that a lot of countries around the world are following, and they want actually to understand how the UAE did this fantastic job. And here in from our perspective at Strata Manufacturing, during this difficult times, we did not stop production any single day. This is not because we are smart. This is because of the leadership of the country. They understood the science and they did everything possible to ensure the safety of everyone on the roads, as well as here on in the different companies, including Strata. Now, let me address your question. I will just tell you about what's happening in our industry. The humanitarian, the economic, and the physical impact of COVID-19 are of historic proportions. I don't think anything like this happened to the entire world at the same time. From an aerospace perspective, we were one of the first hit industries because of the lockdowns. Out of 21,000 aircrafts that has been flying, 16,000 aircrafts has been parked. We have seen a drop in passenger traffic up to 95% in some of the months. Now, if people are not traveling, aircrafts are not being bought, which means that orders are not being requested from companies like Strata that manufacture aircraft parts. This was a challenge. However, because of the fantastic infrastructure that we have and because of the capability of the UAE national and the talent that we have, we were able actually to pivot into a new area that's manufacturing personal protective equipment. We have teamed up with Honeywell, which is a long-standing partner of Strata and Mubadala, and within 30 days from the initial discussion between His Excellency Khaldoon Al-Mubarak, the CEO of Mubadala, and Darius, the CEO of Honeywell, within 30 days, our production activity was up and running. We have acquired the machines, we have acquired the raw materials, and we've also retrained and redeployed, reskilled our talent here, my colleagues at Strata, whether they are the technicians or the engineers or the inspectors. So today we are producing up to with a capacity of up to 30 million masks annually, and these are Mohammed, these are actually N95, not KN95. So the standard is N95, which is the NIOSH American standard. We believe that this is a new area for us. We believe, as Dr. Abdulaziz said, actually it's more than the masks. So within PPE also, we have introduced a face shield line with a capacity of producing 500,000 face shield on a weekly basis. We are serving not our first line of defense only here in the UAE, but also we are looking abroad. And probably this is the first time that we mention it. We've just made our first sale internationally of the N95 masks to Japan. And today our face shields are being used around the world, not here only in the UAE, but also in the United States. So from our perspective, yes, there are challenges, but also there are a lot of opportunities. And it's very important to utilize your infrastructure, to utilize your human capital, and pivot into these new opportunities.
That's excellent. So, Mr. Ismail, we understand that you covered the local consumption and you covered the local demand here, and you started exporting the masks and the face shields to different countries, which is great, actually.
Yes, Mohammed, you know, in all the parts that we manufacture for aircrafts are actually 100% exported. So that's our game. We know how to export. We have the relationships, and we look actually to do more. So in balance, probably I would say 80% of our production should be exported worldwide.
Excellent. Thank you, Ismail. Now we move to our third speaker, Mr. Ismail Tog from Sharjah Innovation Labs at Sharjah Research and Technology Park, which we as Sharjah people are very proud of. Mr. Ismail, if you can tell us more about your tie-up with Emensa and how you came up with the idea of producing 3D face shields. I know that you started with different 3D printing. The focus was on homes, then it was metal 3D printing, and then we heard about the 3D printed face shield. So if you can tell us about the idea, how did it come up in the innovation lab, and then how did you implement it, and you came up with a partnership with Emensa?
Definitely. I mean, to speak a little bit about the lab, so at the lab, we are focusing more on experimenting with new ideas, meaning, for example, when the idea of the demand of the face shields came up, we had to think quickly with several partners, mainly Emensa, who is basically a 3D printing company, one of the biggest actually in the UAE. And the challenge of supplying face shields was very challenging in the beginning of the pandemic. So in the beginning, we experimented with 3D printing these masks. And when we realized the scale of the demand and the difficulty of ordering them from abroad, we realized that we can go full production with them. So we experimented with several designs. We tested them with different clients. And then we went ahead and we produced the mold injection parts, and we started scaling up the production. We faced a lot of challenging actually, because in the beginning of the pandemic, most of the suppliers were inaccessible. The materials, we had to source the materials locally because ordering them from abroad was impossible. And we managed to collaborate with several suppliers to basically come up with a design that can be done very quickly and very cheaply as well. So basically, this pandemic created an opportunity to see the extent of how much we can innovate using available resources. and this is one of the biggest lessons we've learned. If the demand is there, we can make something happen. If the will is there as well. So we started with, so the face shield consists of 3 parts. The first one is the plastic parts, which basically hold the transparent sheet, and we have also the strap, which goes around the head, and we have the transparent sheet. So to think of which materials to use for each of them, and using which machine, which available machine, and then how to build a production line to produce tens of thousands of these to meet the demand was the challenging part, which we had to solve within a few weeks. And basically, we had to spread the operation between different facilities, one which produces the mold injection plastic parts, the other one laser cutting the transparent sheet, and another one cutting and preparing the straps, and then a third facility. One of them was Soy Lab to basically assemble all the parts and deliver them to the customers as fast as possible. So all these logistical problems that we had to overcome during the beginning of the lockdown, and to be able to, deliver those masks to as many customers as possible. It was such an interesting learning experience.
Thank you, Mr. Ismail. Now we move to Mr. Mohammed Javid from Falcon Pack. Falcon Pack is one of the Sharjah-based companies, well-known Sharjah-based companies that manufacture food packaging products and plastic products. I'm sure you have seen their products if you ordered anything from the food delivery companies. Most of the food delivery companies and restaurants use Falcon Pack products. So now Falcon Pack started producing gloves and personal use masks, not the medical mask. So what percentage have you shifted, or to what degree you have shifted your production lines into focusing on these masks and gloves compared to prior to COVID-19 pandemic?
Right. Well, see, because we are anyway in this distribution line of hygiene products, and also from the masks and gloves perspective, we're supplying since many years, and we have a very steady supply chain associated to that. During the COVID, we faced a situation of like we had a high demand for masks, and we had, of course, for the gloves, and because of the situation, actually halted everything, the transportation, and everything. So the biggest challenge for us was to maintain our steady supply, sourcing of these products from our suppliers, and make them be distributed through our channels of distributions within UAE and outside of UAE also. So, and in the initial days of this crisis, we didn't actually have any option either other than to engage our suppliers with us, and to make sure that they don't stop our supplies, and they maintain a steady supply to us in some way. Even though we faced maybe a few days of delay in terms of receiving the supplies from them, but eventually we were able to manage the supply from their side, and we made sure that we have sufficient stocks available to be distributed to different channels. We are not just like manufacturing or distribution company. We also have our retail outlets. So the consumers, because of the COVID situation, consumers' behavior changed, and their preference was shifted toward more retail side. So more pressure we faced or demand we faced from the retail sector and our own retail outlets. So we were supposed to make sure that all the supplies within our retail outlets, as well as our retail customers, we were able to supply to them, and that's what we we tried our best. But now, as we've seen the demand, so immediately we plan to set up our production lines for our masks as well as for our gloves. Gloves is still we are working on. So masks are there, which we are basically producing now, and we are supplying to the market. The demand initially was very high for masks, and even as you know, the price also was very high. But as the time is passing, the supply has increased in the market. So now the demand and supply is getting balanced. So the price is coming down now. So now the masks prices have come down to a very reasonable level where the consumers are finding it very easy to buy. But initially, because of the lack of supply or limitation of supply quantities, the consumers actually were facing issues in terms of the high prices. But now it's okay, and we have done it. So we have added quite few lines of masks into our production line, and we are manufacturing our own masks now. Unlike before.
And Dr. Abdulaziz maybe mentioned that there are a wide range of products and that falls under the personal protective equipment, like the goggles, for example, the head cover, the gowns, and the shoe covers. Do you have these products under your pipeline as well?
Yes, we have a wide range of products. We have from like head cover, then we have shoe covers, plus so we have a very broad range. We have around 3,000 plus SKUs or items which we are supplying, and these are like from we are supplying since like many years. Apart from it, we also have our Falconmec detergent company, which manufactures hygiene products. Hygiene products include also a very broad range. We don't manufacture only detergents, but also like we manufacture sanitizers. We supply in very high quantity. We also have our protection products to protect the surfaces called Super Protection, and which basically serves as a safeguarding or killing the germs on the surfaces. So it's one of the very let's say demanded products these days. And along with it, we have also this range of products which basically helps the protection.
Excellent. Thank you so much, Mr. Muhammad. If we go back to Dr. Abdulaziz. Dr. Abdulaziz, you are also the Vice Chairman for Sharjah University Hospital.
Yes.
We covered the consumers part of using the PPEs and all of this, but we did not talk about the medical and the healthcare sector use of such personal protective medical equipment. I'm sure you as a hospital started purchasing more and more of these personal protective equipment for your staff, for people who are coming to the hospital, and also for nurses and doctors, definitely. Because where maybe not all nurses and hospital staff were using the masks previously, but today I think everyone is using this mask. So within the hospital, did you start consuming more of these protective equipments?
Yes, for sure. At the beginning of the outbreak of COVID-19, fortunately, we have enough stock in our warehouses, and we managed our situation. But after a period of time, we find it very important to order in advance, and we faced some difficulty at the beginning, especially from the local purchase and from the local markets, because all the factories which we are dealing with from Sharjah, from Dubai, and from Abu Dhabi and the neighboring area, they were working in full capacity, and they are not fulfilling all requirement and purchasing, and even the prices has been increased. But with the government control and regulation, they stabilized the situation, and even we found it much more easier to find all the protective equipment for our hospital. As you said, Mr. Muhammad, there are certain items has been increased in use, especially the sanitizers. Sanitizers has been used much more frequently, even within the hospital and for the patient, for the visitors. Although that we limited and restricted the visitors, but still we need to put sanitizers all the places that the need of using it in the emergency and the corridors and before entering the rooms. There are a lot of dispenser for this kind of sanitizers. In general, we can say that the consumption and the purchasing of all of these personal protective equipment has been increased in certain point to 4 times, fourfold, sometimes double, but it depends on the time. And now still the demand is available, and we are consuming double as we used to consume as before COVID-19. As a precautions and as also type of requirement to control, to keep our personnel safe, and also to protect our patients from any kind of infection. So I think the market, it will increase in the production of this kind of equipment, and also in shifting, as Mr. Javid said, Muhammad Javid, he already said they were in the market and producing head cover, mask, gloves, gown, shoe covers before, but it was mainly for the food industry, for the handling food, for the kitchen requirement, for the household. But now it has been shifted to other place, which is the healthcare providers also. So there is a great demand. And even in Strata, we are very sure about the quality and the type of equipment and products available and produced in Strata with international recognition of this kind of face shield, for mask, and it has been shifted from building some kind of or manufacturing some part of the aircraft to also personal protective equipment, which is very important for the national security of the UAE, because if we have a facility and capable to shift their production from one item to another item to fulfill the requirement of national security, this is something that we are very proud, and we encourage all kinds of industry which can do the same thing. Even in Sharjah, Technopark or Technology Park, Mr. Ismail Tog, he already spoke about the face shield. We are very proud of it. When they started at the beginning of the COVID-19 outbreak, I remember Mr. Hussein Al-Mahmoudi, he called me, he told me about the production line, and they are available. And if there will be cooperation between Sharjah Health Authority and with them, exactly, I told him that we need this kind of cooperation, because these items are in a great demand, and we want to continue such kind of innovation or products which can enhance the industry and also to fulfill the requirement of the government.
Excellent. Thank you, Doctor. So difficult times brings new opportunities.
Yes.
This is exactly, this is what we are discussing today. And if we go to Strata again, and if we look at our title today, which is shifting mindsets, and I think what has happened with Strata is a perfect example of shifting mindsets from aerospace to a tie-up with Honeywell and producing the N95 mask. Mr. Ismail, do you think that post-COVID you will still produce the mask beside producing the aircraft parts, or do you think that you will go back to focusing only on the aerospace, or you think that you will open a third production line for a new product that has nothing to do with personal protective equipment and aerospace? Now you have this experience in shifting the mindset and producing completely different products and items. Do you think that you will continue doing this, or you will still focus on the aerospace after the COVID pandemic? And especially yesterday, we heard that Russia produced the first approved vaccine.
Thank you, Mohammed. From our perspective, what we want to do, or what we have learned from this pandemic, is that we really need to be agile in utilizing our infrastructure, utilizing the human capital that we have to pivot. The aerospace industry will never be the same. So the new normal for the aerospace industry is not what happened back in 2019. It will take us at best 3 years to recover, probably up to 5 years to recover. On long term, the fundamentals of the industry are strong. However, what we are working on right now is that the sustainability of the new production lines that we have put in place for the N95, and we are actively pursuing a number of opportunities related to med-tech, anything related into the medical area, for a specific reason that Dr. Abdulaziz mentioned, which is national security. How we can actually address some of the needs for the local market while we keep an eye also on the regional market and worldwide. Today, we are looking at probably a number of opportunities in those areas, and we want to diversify. So in the future, we will not only be doing aerostructures, we will not be only doing masks, we will be also doing a number or we will have a number of lines related to med-tech to address the needs here in the UAE as well as the wider region.
Excellent, thank you. Mr. Ismail Tog, I will address the same question to you. You as Sharjah Innovation Lab, what will be the focus post-COVID-19 pandemic? Will you still continue doing face shields and all of these things, or you will shift to a different industry?
Well, the mindset we have at the lab is that we need to show some examples of what kind of products that can be designed, tested, and fabricated and manufactured locally. And the face shield is a really good example of that. In general, we are looking at a wide spectrum of products, not only in the medical field, but in a lot of other sectors that we will see that probably the pandemic will prove that how capable we are of actually producing these products locally. So not necessarily we will be focused on the medical field, but we will still be affected in terms of our mission and vision in the future by the pandemic. We are working on several projects at the moment. We are doing the research. We are experimenting with some parts, 3D printed parts, to try to put together new lines of production. We're working with several partners who come up to us with some ideas and opportunities, and we are taking on these projects. Basically, that's the main objective of the lab. we want to open the doors for companies, for government entities, for individuals, for universities to basically come and find all the tools, machines, equipments, expertise under one roof to be able to produce these prototypes quickly and put them under the test to see how effective they are, and then help them with the initial production in a small scale to test the market. So this is our plan, and we will continue doing that. Of course, there is going to be an influence of the current situation, which I hope that it's something that we will be able to take advantage of because of the current difficulty that a lot of industries face at importing different kinds of products that can be easily manufactured locally.
Thank you, Mr. Ismail. We look forward to hear more and more good news about the ambitious plans of Sharjah Research and Technology Park and Sharjah Innovation Lab. I will address the last question to Mr. Mohammed Javid before we shift to our question and answer session. Mr. Mohammed, you mentioned that we have reached to a balance between the supply and demand, and the prices also reached to the balance and dropped. Do you think that there are still untapped or unexplored opportunities when it comes to PPEs, like what Mr. or His Excellency Dr. Abdulaziz mentioned in the beginning, or the market is saturated right now and there are no unexplored or untapped opportunities in the PPEs?
Well, to be honest, technically speaking, I won't be able to give you very clear information about the products, right? Because that is basically handled by our CEO, deputy CEO. What I'm going to do is, like, I'm going to explain from the perspective of our own strategy that we are looking for. We are present in UAE very extensively. We are tapping a lot of customer segments. Now, one of the segment which basically is medical side, we have not actually really entered in that particular segment effectively. So, but now our approach and strategy is that we are going to be available in the medical sector, supplying them a wide range of products specific to their needs. Apart from it, we are also looking to expand our presence, increase our presence in GCC countries. We are already there. We have a penetration strategy. And in the coming years, like up to 2023, we have a very aggressive strategy. But due to this situation this year, we had to slow down. And apart from GCC, also we have our very aggressive growth strategy globally. We are present already. We are supplying to a lot of countries. We have a lot of our steady channels of distributions in different countries. So what we are going to do, we are going to capitalize on our current channel distribution across the globe, as well as in GCC. And we are going to increase our range of products offering to those countries and to those markets, which will include, of course, the hygiene products and PPEs associated with the current need due to COVID-19 situation. Because for UAE market, alhamdulillah, we have a major presence and excellent market share. But for GCC, we still have quite big room to grow, where we are focusing on Saudi mainly, and other countries, like we are present in Kuwait, we are present in Oman, in Bahrain. And plus, apart from it, now like we are entering globally in markets like Middle East, Africa, very aggressively. Now we have also started our distribution within supplying to Canada, USA, and also the other like Europe countries also. So we're expecting like a very good opportunities coming up for us. We have the capacity, and we have a very robust strategy and very aggressive plans to expand our even capacities if it is required due to the demand increase. Because multiple channels, definitely the demand, we are expecting a lot of demand is coming toward us, so we have to respond to that. For that, we already have put a lot of plans in place to expand our infrastructure resources, and at the same time, we are going to make sure that our quality is going to be the best quality in the market. We don't compromise on the quality, and keeping that in view, we definitely are going to make sure that the brand Falcon Pack, as well as because it's a UAE company, it's going to represent UAE very well across the globe through its products. Inshallah.
Inshallah. Thank you, Mr. Javeed. So I think all of us here agree that COVID has affected all of us as human beings, affected our behavior, it affected the businesses, and it changed the mindsets of businesses as well. Even we as governments changed some of the rules and regulations to adapt with these changes that happened due to COVID-19 pandemic. But this created a lot of new opportunities for businesses and for governments and for us as human beings as well. We still have 8 minutes to go. We will see if we can have some of the questions and answer them. One of the questions that I have here says, masks should mandatorily have information on whether they offer COVID protection. Currently, all kinds of masks are being sold in the market. I don't know if Dr. Abdulaziz wants to comment on this.
Yes.
Is there actually a good mask and a bad mask?
Well, there are different type of masks. And the question is correctly in its place. It has to be mentioned on the box or in the information of the mask, what type of mask this is and what is the purpose for it. Because before we have mask for the dust, we have for painting, we have for medical use. So there are many type of mask, but mainly the N95, it is the one that is widely accepted as a protective mask against COVID-19, against COVID-19, but it is not normally used in the community. The most people use the normal surgical mask, which are 3-layer type of mask. This type of mask can minimize the number of infection or the degree of infection or the possibility of the infection, but it can not protect 100%. The only thing that you have to choose the proper mask for yourself and the mask which is approved by the quality or the economic departments or economic ministry of economics in UAE. And there is a standard of quality also. It has to be with the standard of quality, which is هيئة المقاييس والمواصفات. This is what the special entity, yes, standards and I think excellence.
Standard and measurements.
Yes. So it has to be this kind of selection in the mind of the customer.
And there was another question on how does local or federal government is supporting agility of companies to adapt to COVID-19 and post-COVID new normal and generate new source of revenue and absorb the drop of revenue. I might take this question as the Invest in Sharjah or Sharjah FDI office CEO. I mean, both the federal government and different local governments have launched different stimulus packages for the private sector, whether it's with banks, whether it's with visas, whether it's with labor laws. We saw also a lot of exemptions from different fees on the federal level as well. We saw a lot of stimulus packages where we covered in a different session. But again, we also as Sharjah FDI office during the pandemic, we have launched a hotline where we helped a lot of companies to actually shift their businesses and be more flexible with their production lines. I always talk about this example because this actually happened where we helped a lot of companies to shift their production lines from chemicals to sanitizers, from plastic to masks. Again, we helped a lot of food companies also to help in producing more during the pandemic because of the food security issue and all of this. So the local governments and the federal government have done a lot actually, and the businesses within themselves also should be more flexible to pivot from their strategies and to change their strategies during the pandemic, like the examples that we have seen with the Strata, with the Falcon, and there are so many companies actually that changed their strategies and benefited from the new opportunities that were created because of the COVID-19 pandemic. I think we have reached to an end of the time for our session. I would like to thank the speakers. Dr. Abdulaziz, thank you so much. Mr. Ismail Abdullah, thanks a lot for your participation and for your interesting example that you have given us and showed us today on shifting mindsets. Thank you, Mr. Ismail Tog, also a perfect example out of Sharjah Innovation and Technology Park. And thanks to Mr. Muhammad Javid. Falcon is a company that we are so proud of to have based out of Sharjah. Thanks also to the attendees. Sorry, we could not take all of the questions, but I will make sure that we come back to you through the emails to answer all of the questions. Thank you so much once again, and hope to see you very soon in another session.
Thank you very much. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.